Good morning and welcome. Thank you so much for tuning in to our third and final webinar on early childhood educator compensation research. I am Candace Weber. I serve as Partnerships Director for the Louisiana Policy Institute for Children. If you are not familiar with our organization, the Policy Institute is a statewide, nonpartisan, nonprofit organization. We serve as an independent source of data, research, and pertinent information for policymakers, parents, providers, or anyone who truly wants to understand the state of early care and education in Louisiana. And just to give a bit of background for this compensation series that you're on, in 2022, the Policy Institute began intensive work to respond to the ongoing compensation crisis within the early care and education sector. And our aim was to examine the issues, develop provider-centered recommendations, and to determine next steps for improving early care and education workforce compensation. In this webinar series, we invited leaders who are implementing strategies to increase early care and education compensation to come together and share what they've learned so that it can be replicated in other communities across the state. In the first two webinars of the series, we focused on strategies to increase wages. However, we know that compensation includes more than just that. And so through our research and surveys conducted, we surveyed both childcare providers and staff. And we learned that most early educators typically do not receive workplace benefits like healthcare or retirement contributions. And so to learn more and to actually read the report from our latest research, we're going to drop a link in the chat so that you have access to it. And it's specifically on our latest research regarding early educator compensation. And so while most early educators typically don't receive these workplace benefits I just mentioned, there are some child care providers who have figured out how to offer employees workplace benefits while maintaining quality programs and not pricing families out. To that end, today's webinar will look at ways to increase early educator compensation beyond increasing wages. And so first, we'll hear an overview of the variety of ways to increase compensation beyond wages. Then we'll have a panel discussion with Louisiana early care and education providers about their experiences and suggestions for offering employees workplace benefits. And then lastly, we'll hear about the support available to early childhood educators in finding and applying for benefits. And so at this time, I am honored and excited to introduce our first speaker, Lauren Hogan. She serves as the strategic advisor and content writer at the National Association for the Education of Young Children, also referred to as NAEYC for short. At NAEYC, Lauren has held a number of leadership positions over the past decade, with responsibility for a portfolio, including federal and state policy and advocacy, higher education, accreditation, professional recognition, position statements, and applied research, and with an unwavering focus on centering the voices of educators, shared leadership, innovation, diversity, and equity. In fact, NAEYC just recently published a brief that explores several types of benefits and supports, which you'll hear Lauren speak about this morning. But the report highlights promising state, local, and programmatic examples and shares recommendations related to benefits. At this time, I'm happy to welcome Lauren, and thank you so much for being with us this morning.
Thank you. Excited to be here. And looking forward to getting to chat with you all afterwards, because I have the privilege of doing sort of the big picture overview, and then I'm really excited to hear about the panel from the educators as we dive into some of these pieces and how folks can think about it. I'll just say overall, I think one of the reasons that we even started to dive into a focus on compensation, of course, wages, look, wages are a key part of this. We're not going to pretend they're not. But one of the reasons that we started focusing on also thinking about all of the other pieces is that's the feedback that we heard from the field. What do they need to come in and stay? How do they think about their jobs? What does it mean to be part of an early childhood education profession that centers professional benefits as part of that? So I'm going to walk through some of the pieces today, just again, at a very high level. I encourage folks to dive into the brief. We'll drop it into the chat. Because it really gets into some of the details and has a ton of links out to the examples that folks can really spend time diving into. So let me go to the next slide. This is the only time today I'm going to try to talk about the problem. I think we all know what the challenge of low compensation is in early childhood education and what that means for families and for educators. But just to sort of put a fine point on the reality of the low wages and lack of benefits, it is inequitable even within this unfair field. Black women and women of color have lower access to health insurance, have lower access to retirement savings. Family child care providers, it's not equal in its distribution, even within this sort of low compensation field. It drives educators out of the field, it keeps folks from coming into the field, it undermines the quality, and it creates staffing crisis. If we don't solve this compensation challenge, and that does include benefits, we're going to keep having this conversation forever and ever. So I want folks to know, if you walk away with nothing else from this part today, these are solvable problems. People are actively solving them in Louisiana and across the country, in programs and in states. We're going to toggle back and forth a little bit between policy and programs, so what states can do and what programs can do to be able to advance solutions here. But the solutions, both sort of tried and true and innovative solutions, really exist out there. So hold on to the idea that this is doable and that we can do this. Just briefly, I want to point to sort of why access to benefits matters on the next slide. Again, this is partly helping make the case for your own communities, for policymakers that you work with, for families. Why is it important that we even talk about this? And here are just some of the reasons. Obviously, it supports well-being and program quality, recruitment and retention. I think this question of parity is really important as we think about folks who move from setting to setting, how we think about not having that only be about the pursuit of benefits, but really about where they want to be and not just driven by what they can get access to somewhere else in a different setting. It obviously promotes gender and racial equity to the disproportionate impacts we were talking about a minute ago. And it brings in additional funding sources to support early childhood. We cannot rely on childcare subsidy funding to solve everything for our community. We've got to access all these other funding streams in workforce, in health insurance that are out there for us to tap into in ways that support early childhood educators and education. And I think big picture, really thinking about how this advances the recognition of early childhood as a recognized and valued profession. Professionals have access to professional benefits. This is a recognized piece of what it means to be an early childhood educator, and moving us towards that is super important. Okay, this sort of advances on the next slide. You can see we're talking about a really expansive understanding. Right? You have your traditional benefits, right? Your health insurance, your retirement savings, your paid leave. Those are super important as a foundational element for how we talk about benefits. But we're also thinking about compensation writ large. And that means thinking about educators' cost burdens in areas like, as with so many families, higher education, childcare, and housing. What can we do to specifically reduce the cost burdens for early childhood educators in particular, again, in our programs and in policy writ large? And then there's a set of sort of actions and supports that allow folks to really take advantage of these benefits. So they include things like substitute pools, using contracts and grants to do some of this work, income disregards, which I'm going to spend a minute on in a little bit, and sort of compensation scales that, again, start to make this an expectation regardless of state and setting that really advances the work here. So this is the categories in which we're going to think about this. This is a link to the brief as well, as sort of folks can sort of get into that when I'm not trying to run through it in 15 minutes. Okay, we're going to go to the next slide on increasing access to health insurance. Again, regardless of how we feel about the idea that health insurance is primarily an employer-sponsored benefit in the United States, the reality is that half of workers have employer-sponsored health coverage, but not in early childhood education. In early childhood education outside of public school, only 23% of educators do. And the uninsured rate, surprising nobody, is 3 times as high in states that have not expanded Medicaid. So we're thinking about the combination of employer and public benefits that can support early childhood educators. It's such a pleasure to be able to point to Louisiana actually as a place where folks are innovating around using navigators specifically to make these connections. And I know you guys will hear more about this later, so I won't go into detail on this, but there are states that are thinking about different ways connecting early childhood educators to health insurance in the marketplace, thinking about covering premiums. And that's something that both employers and states can think about how to do that in order to make sure that early childhood educators in their programs have greater access to these pieces. And this is just fundamentally, we know so much about the importance of access to health insurance in terms of educator well-being, and in terms of, from an employer perspective, stability, their ability to provide quality, all of these pieces. This is a key aspect of making sure that we're able to do this. Moving on to retirement savings. And again, this is really we're just going to sort of move through the buckets so you can think about how some of these pieces are really going to help. Retirement savings is really out of reach for so many early childhood educators, and it's intersecting with a older early childhood educator population. 25% of center-based and 40% of family childcare providers are over 50. So we need to think about what that means for their own health and stability. Very, very few childcare providers have retirement benefits compared to the broader population. And this statistic just devastates me that, like, both in 1989 and 2014, which is a long time apart, 80% of folks were worried about their ability to save for retirement. We got to move the needle on this a little bit more. Like, we can do more here to move on this. These are some things to focus on. There are amazing examples of programs that have worked to provide retirement savings using, again, sort of stabilization grants, putting money aside, rather than just doing bonuses, making them into matches as 401ks or 403bs, to be able to set that up for early childhood educators. And the Children's Village story is also in the brief to tell a little bit more about that. The Opportunities Exchange brief that is also linked here goes into how programs can take advantage of tax credits that help give them access and support them in providing these retirement savings for their workers. And so that really exists, and I think they're very underutilized. But there are really ways to tap into some of those as an employer and as a program to be able to, as a family childcare provider, a sole proprietor, and or for folks who are in your program as a center or family childcare home. There's also state efforts to be able to provide retirement savings to the entire population. This is one of those things where it's universal, but childcare can tap into it, and or you can try to make it targeted just for this particular population because they're so important to your state's functioning economy, and sort of making that case for policymakers as well. On the next slide, I just need to give a shout out to the importance of paid leave. This is just multiple ways to think about it: medical, parental, caregiving, deployment. There are a number of different kinds of paid leave. And there are states and programs that are just making this a reality for folks, again, across the board, and ways for programs. Look, it's hard. It's always hard for small businesses to adapt to paid leave. But as folks who understand the importance of early childhood education and working with families and young children, especially when we think about parental leave and caregiving leave, it's just really important for us to think about how we support our own educators and being able to take that time for themselves and their families as well, because it's something we care about writ large. Okay, I'm going to move quickly into sort of the bucket of reducing costs. This is also, our goal is to raise up wages and benefits, and partly we can do that by putting more money into educators' pockets, and we can do that in part by reducing some of their costs that they have to deal with on a daily, weekly, monthly basis. Higher education is one of those. We think about 20% of early childhood educators are carrying student debt, and that's based on a number of different research points. The loan forgiveness that exists, everybody should be taking advantage of. If you are carrying student debt or you are asking folks to take on the pursuit of degrees and credentials as part of a state and moving this forward. Obviously, scholarships are an important part of that on the upfront side, but on the back end side, how do we reduce costs that people have already taken on? There's a new plan from the federal government called the SAVE plan that folks can tap into. And the reality in our field, because of the role of, for-profits, obviously nobody's making a ton of money, but for-profit by tax status, it's not always inclusive on the overall loan forgiveness side. So we've been working with the department and other folks to help think about how to make sure that this is accessible. States have taken on the role of providing student loan repayment assistance and being able to provide educators with that kind of assistance directly targeted towards early childhood educators in all settings. And states have also moved towards what's called a last dollar scholarship, especially around community college. So there are a couple of states that have moved in that direction as well, both red and blue. And it's been really great to see that kind of support, especially on the community college side, as folks think about their associate degree and what that means to be able to move them forward, both for their own, well-being and their family's success, as well as the importance of quality. When we think about reducing, I'll answer questions in the chat, but I can see this one pop up. Sometimes I can only see a couple of them. But yes, the SAVE plan just opened this summer. And it is available. I will drop a link into the chat because folks should definitely look into it. It's a new way of thinking about providing some of the loan forgiveness that I'm encouraging folks to look at. Reducing childcare costs. This has really caught fire this year as states look at how to ensure that early childhood educators can afford childcare for their own children. And that really came out of something we heard over many years, that this is really unfair. I'm working in a program and I cannot afford childcare for my own kids to go to this program. The burden would fall on educators and program leaders who would sometimes provide low tuition or reduced cost tuition, free tuition for that program to their educators. Shifting this onto a public requirement where we provided access to childcare providers, to childcare assistants by prioritizing them has been a big benefit for folks on our recruitment side and in terms of this, again, the stability and reducing their own costs. And you can see some of this on the next slide as well. I will say all of these are links. So if we share the slide, most of these things are linked to the other things where they get into more detail about this. But it's another way of thinking about a benefit that we can provide to early childhood educators. On the next slide, we get into housing. I just want to highlight this. Look, most of us are not going to be able to do this. We're not going to be able to build specific houses for early childhood educators working in our programs. That's a reach. But it is happening, which I think is just so cool. This is a program in New Haven where they partnered to build housing for their own educators. This happens in states too. They target firefighters, teachers with low rate mortgages and low interest rates that are specific to ensuring that folks who work in the community can live there. Expanding that to include early childhood educators hasn't been done much, but it's an opportunity to pursue some of that, along with thinking about specific solutions for family childcare providers, because their homes are where they provide that childcare. And so really thinking about there's zoning regulations and barriers that get in the way of them being able to do that, and being able to address those as part of an overall look at how we can support family childcare and making sure that they're able to participate fully in the childcare system. I just want to spend a minute on additional actions, and then I'm going to turn it back over to you all to get into the panel as well. Substitute pools are really critical. We don't really think of them as a benefit, but without them, it's very difficult for folks to take advantage of all these other pieces. It's hard to take advantage of paid leave. It's hard to take advantage of higher education sometimes when there isn't a substitute pool to support that. And some of these are on the next slide. So both from a state perspective and a sort of a programmatic perspective, thinking about how to create those kind of substitute pools, thinking about what shared services can do to support that, family childcare networks, how we can really integrate some of these pieces to provide that. Contracts and grants are another one, and there are lots of ways to think about using contracts and grants, again, both from the policy side and the programmatic side, to focus on increasing compensation and benefits. Income disregards is a strategy. So again, when folks get access to increased wages, sometimes that makes them hit a cliff, right? Where the benefits cliff, where they make enough that they've been kicked off the program, but not enough to make up that difference. And we've all heard about educators who turn down wage increases because of that looming benefits cliff. An income disregard allows the state to say, we're going to pretend that that income doesn't exist and continue to provide you with this benefit that you need while you continue to make more until it's enough that it is worth it to you and your family, basically, for that economic self-sufficiency. Specific income disregards for early childhood educators as they move through this process could be a really meaningful strategy to make this a truly expansive support for educators. And the last thing I'll say is just thinking about compensation scales that, again, talk about benefits as part of this, as a program that lays this out for what folks can expect so that they can start to see it everywhere. It does put it centers the importance of that in a way that I think is really meaningful as folks begin to move this work forward. So the last slide is just a little bit on messaging as you think about helping policymakers put compensation first, just thinking about really getting into your specific wage and benefits data. It is still shocking how many folks have no idea how much early childhood educators make or how little they make, especially for parents who are paying so much they cannot understand why the market is working the way it is. So really helping to explain that, establishing those comparisons, and just talking through the benefits and the impacts of what low compensation and increased compensation really means for the families and businesses and educators who are in your community. Okay, I'm going to breathe because that was a lot. And I'll answer some questions in the chat. Happy to hang around and can't wait to hear about all of the educators and what you all have done to really advance this work on the ground. So thank you all so much.
Yes, thank you, Lauren, for providing all of this information and really setting the stage for just the variety of ways that we can offer benefits. And so I know there are some questions in the chat. I have questions as well, but we're going to keep moving us along. But if you do have anyone on the call, if you have questions for Lauren or her presentation, we want to encourage you to continue to put those in the chat, and we're going to get to those towards the end as well, or maybe even within our panel discussion. So now I'm excited to invite some of our early childhood providers in Louisiana who will talk about their experience with providing benefits. And so on our panel this morning, we have Jonathan Pearce from Sugar and Spice Children's Academy, located in Lafayette, Monique Rouege from Carlie Care Kids in Harvey, and Kristi Givens from Kids of Excellence in New Orleans. And so because this is a panel discussion, again, we encourage you to ask questions in the chat, or if you want to just ask your question, use the virtual hand raise to be recognized, and we will get to your question there. So we have a few questions to start out, but first, I will allow our panelists to take just a minute or two to introduce themselves, tell us about their center. So things like how long the center has been around, the size of the center, how many kids you're serving, how many employees or staff you have. And then specifically for this webinar, tell us what benefits you offer. So Jonathan, I am going to start with you. Again, introduce name of your center, and just tell us about the center and then the benefits that you currently offer.
Absolutely. Thanks, Candace. And thanks, guys, for having us. So my name's Jonathan Pearce, and we have 4 locations of Sugar and Spice in the Acadiana area, which for those out of towners, that's South Central Louisiana, Cajun country. So with the 4 locations, we've got roughly a little over 500 children, school agers included. And then we also have about 92, 93 employees. That includes maintenance staff, transportation, cooks, administrators, teachers, and the like. And we have been open for 42 years. Actually, it'll be 43 this year. So we're been around for a little while. And we, Candace, are we getting into benefits right now, or?
Right now, just tell us what the benefits are. We're going to get deeper
Okay.
into, yeah, just tell what the benefits are.
So we recognize the need. We believe in taking care of our people because that's who takes care of us and our children. So we offer a major medical plan carve out, which is a carve out group for our administrators and directors, assistant directors, but we also offer an ACA plan that is an affordable plan. We also offer supplemental benefits that staff can opt into, as well as the simple IRA with a 3% match, vacation time, and we rent a beach house in the summertime for about 3 weeks, and we have one of our staff that our vice president actually goes, cooks for everybody, and then we rotate people in and out, and then we do an annual employee breakfast, which we just had this past Saturday.
Nice.
We give out awards and all kind of fun stuff.
That's awesome. I'm sure there's going to be questions coming to learn more about your offerings, but thank you, Jonathan.
Absolutely.
Monique, can we go to you next?
Sure. Can everybody hear me?
Yes, we can hear you.
There's some background noise. Yes, hi, my name is Monique Rouege. It's a pleasure to be on the panel today. I have 3 centers total, Callie Care Kids, Preschool and Academy. That's my 2 centers on the West Bank. They've been open for the last, I've been in business there last 17 years. And also I have a new center in New Orleans, which is World Class Learning Academy, and we just opened that up like 9 months ago. So that's something new that we're embarking on. Among everything, I guess all of my children, we would have like about 255 kids across all sites, and about 43 employees so far. So not as big as Jonathan, but in the mid area. So the insurance benefits that we offer health insurance, vision and dental, life insurance, long-term and short-term. We do offer a 401k retirement plan, and paid leave, vacation, and holidays.
Love that. Awesome. Awesome. Kristi, we'll shoot it over to you.
Hello, everybody. This is Kristi Gibbons with Kids of Excellence. I have been in business over 25 years, and just this past week or 2 ago, our center had just renewed our NACE accreditation. So all 3 of our childcare centers are NACE accredited. So we're really excited about that too. We've been NACE accredited for over 10 years. And some of the things that we offer a carve plan, a health insurance for our administrative staff that we pay 100%. We offer vision and dental, short-term and long-term disability and life insurance that is paid by the child care center. And we have other supplemented insurance that they can take that they pay for themselves, but these are all the ones that we pay for. We also, in all of these plans, are offered in health insurance is immediate for administrator when they become administrator. All the other plans is within 90 days. Then we offer 401k with a 3% match that is offered after 6 months. We do all pay holidays. We do 3 weeks vacation for our staff because we are closed 1 week in the summertime. We are closed 1 week for Thanksgiving, and we close 1 week for Christmas. So all 3 of those, when the center is closed after 1 year being employed at Kids of Excellence, you are eligible for that. You're also eligible for paid personal sick days after 6 months, and we give 12 hours for personal days and 12 hours for sick days. And also we pay, we have half day if you have a birthday, and we pay for you to be off. We also do events all throughout the year to help build up staff morale. So every quarter we do something special for our staff and have them all come together. We go outside the center. We do team building. Just this past one, what we did, we went to the escape room at in the French Quarters, and all the staff was there, and we pooled everybody in different groups, made sure Senate people was from different centers, was not in the same group. And the winners of the whole escape room was my grandkids who was with me. They beat all the staff and got out the room with 14 minutes to spare. They're very smart, so they beat all the staff, but we had so much of fun. And then we went and ate, and we did had all kind of fun in the French Quarters. The staff was so excited and they were so happy. So we try to do really exciting things throughout the year for our staff. So next year we want to bring them to really this year we want to bring them to the Macy conference. So we have to start thinking about how we're able to do those things. And we have one of the highest compensation that we paid staff, that our staff who is have a CDA make $19.25 an hour, and ones who have a associate's degree make $20.25 an hour, and if you have a bachelor's degree, you make $21.25 an hour. And we have people that work for us that has all the way up to a bachelor's degree.
Very awesome and very cool, the things that you guys are doing. So, well, let's get into the discussion. And first, I just want to say thank you to all of you for not only deciding to, offer benefits, but just even how you've implemented it, with your centers, and obviously your staff is better for it. So my first question is, I see that, your centers, all three of you, your centers have been around quite some time. So when did you start providing benefits for your employees? And at what point did you need to reach before it made financial sense for each of you? So anyone can start, but this question is for all three of you.
So I think for us, it was we actually started offering, and we didn't just start everything all at once. And I think most people say the same, but it started with a realization that, a lot of our administrators did not have a plan for retirement. They did not have a plan for, what was next in their lives. And then we found out that they didn't have insurance, health insurance. And so we started really looking into it, and then, we found the right people. And I think that was the big part of it. We got friends in other industries that kind of helped guide us along that route. And I think that was a huge benefit to us as far as, navigating the unknowns at the time. And so, without that, we would have been lost.
Yeah. And at what point did you start? Been in business 43 years. At what point did benefits come on board for the?
So yes, good question. So not until probably, and I don't have the specific date, but like I said, health insurance was the first one, and that was probably closer to the early 2000s, maybe about 2002. And I had just completed getting my business degree at UL, and that's, and that's when we really started talking about it. And so it was around the early 2000s. And then once we did the major medical, and that was a Blue Cross Blue Shield plan with, it's actually a very good plan, low deductibles. And so it was popular with our administrators. And then we did charge them a certain, a percentage of that. But then we started offering the supplemental soon after, and then the retirement followed that. But for years, since the beginning, we offered vacation days, a tiered vacation day plan with, we'd start with everybody would get a birthday or one day for their birthday. They didn't have to take it on their birthday, but they'd have one day off a year. And then it moved to after they've been here for 3 years, then they got a full week. No, I'm sorry. After they've been here for 1 year, then it was a full week. And then after 5 years, after 3 years, it was 3 weeks, 2 weeks. I can't talk. I can't. So yes. So one day when they start, and then after a year, 1 week, and after 3 years, 2 weeks.
Awesome, awesome, awesome. All right, Monique or Kristi. So the question is,
Okay.
when
Go
did
ahead.
you
You can-
start? Yeah, the question was, when did you start providing benefits for your employees, and at what point did you need to reach before it made financial sense? So tell us when. I mean, you've been in business 25 years.
Oh.
What point, and then what was the point you needed to reach?
Well, for me, myself, I mean, we started benefits at the beginning of 1999 when we first opened. We had a capacity of 57 kids. And it was like birthday and vacation. We had already started that because what really got me started to know this was important before I even opened up early childhood. I was a general manager at a restaurant in the French Quarters for 13 and a half years. And when I first started at that center, I was a cashier and moved up to the highest position. And we had no benefits for the employees. So I knew how important benefits was, and I was able to implement health insurance, all types of benefits for the employees at our restaurant that, the owner was so against, but I had to push and push and push for him to finally to do that. So that was already my passion, and I knew that was important. So when even I knew I wanted to open my business, I knew that this is what I wanted to do, because as a single mother with 3 children, I knew the benefits I needed for myself to be able to be successful and to be able to move up the ladder, because it really, like when I first started, I was on welfare, and getting food stamps and all of these things. And I was just like, this is not where I want to be. So I have to advocate in this restaurant to help me to move up in pay and be able to have the benefits that I'm losing when I'm moving up in pay. So that was already one of my visions at my center when I first opened. So when I do budgets, because I like to play with the numbers, and I was like, okay, I want to do all these things, but we don't have enough capacity to be able to do this. So I knew I had to grow. So, I mean, we have 3 centers, we have 174. My ideal goal is to be able to do 200 kids, and I think we'll be where we need to be, but still fighting to make sure we able to get more money for kids to be able to keep doing these things. So we started at the beginning, and maybe the last 10 years when we did the core plan for our administrative staff has been over 10 years. And it helped me to keep some really great ladies. They never had to pay anything towards their health insurance from the beginning. We paid the full health insurance. My goal is one day to be able to provide health insurance for everybody, but I could have made a decision to pay my staff less money and offer them health insurance. But from having conversation with them, I asked them what they wanted more. Do you want to make $16 an hour and I provide you health insurance, or you want to make this? And the staff decide, we want the money, we need the money. And they were able to explain to me why they needed the money more than they needed the health insurance. So we went those ways, and then we start adding to our supplement plan. And then, I just start looking at different companies, and we were gardening, and we were Blue Cross for our health insurance. It's a great plan, but they really had a good supplement plan that was very reasonable and affordable for me to pay. And I was able to offer more different insurance to my staff. And I forgot, we also offer them life insurance. And believe it or not, these people didn't have life insurance on themselves, and now they're able to get pennies of insurance on their husbands or their children and all these different things. But it was a part of me from the beginning.
Awesome. Monique?
And so for me, I applaud Kristi and I applaud Jonathan. So for me, mine is just a little bit different, because I started offering health benefits maybe 8 years ago. And one of the reasons is that I was broke when we first started the center. So it makes no sense for me to say that I had money, because we didn't. So when I came from I have a master's in finance. So I clearly know that when you don't have it, you don't have it. And I can't make it come out. It is what it is. So going into a new business, especially one of my own, that was the first time that I embarked in it, because I always worked for corporate. So, you know, we always had these benefits. However, when it wasn't adding up, it just wasn't adding up. To me, payroll and all the other expenses, operational expenses, there was no way I was able to offer health insurance, life insurance, long-term, short-term disability at all. However, when I came in, we always did pay for holidays and we always did pay for vacation. Because leaving out of the corporate entity, even though you work for 500, you know, these multi-million-dollar companies, they still don't offer, you know, the benefits the way people think they do. Because it's a streamlined process. It's a lot of employees and it's a lot of overhead. So getting into my own business, I realized that. But I did know that one, increasing the funding always increased benefits opportunity. So over the years, we were able to add on as we go. So after 8 years of struggling and then jumping into my next years, we finally saw a situation where we were able to have more, more money to invest in our employees. And I wish that we were able to do it early on, but I couldn't. But now we're in a position where, we're pretty much at a plateau because if the funding is not increasing, then you have to leave things the same. There are, just hearing Kristi and just hearing Jonathan, I could see there is other aspirations that I would like to give to my employees. And when the increase happens as it relates to the funding, then that will happen. But right now, we're secure in those health benefits. My administrative staff has always had them. We just opened it up to the rest of the employees. The employees that I have, most of my employees don't even take in those benefits, the health benefits, because they're on Medicaid. They do utilize the vision, dental, the life insurance, and the long-term and short-term disability. They have been educated on how the 401k works, and so they are investing in themselves as well so that they can have a retirement plan once they leave. And of course, paid vacation and paid holidays has always been one. And, of course, I do bonuses, throughout the year. But that's really where we stand.
Awesome. And thank you for sharing. And Monique, I know, I believe as a part of Child Care Coalition, that also helped you get better insurance rates, right? Can you talk about just how that got started and how that helped lower costs for your employees?
So I'm the president of a nonprofit organization, Child Care Coalition. And what happened was, I'm a partner with Clover. Clover was my very first partner. And 6 partners from that Clover entity joined together because we knew that we needed to bring awareness around early child care and just the funding sources and things that we needed for our children and for our teachers. So when we joined our organization, we would do a lot of advocacy work, especially in Jefferson Parish, because there are a lot of, even though there are systemic racism everywhere, but there is plenty in Jefferson Parish. So to try to break down those barriers, we joined forces so that we could actually try to make them understand the importance of, early child care and the fact that, there are a lot of Black and brown children that look like me that cannot get the affordable access, and teachers that are not getting paid because funding are not coming down the stream. So with that coalition, what we did was we got a broker that was able to streamline some prices for us for the health benefits. And it took some time. I did not believe that it would take that long, but it did. And graciously, we did get some quotes and we were able to offer benefits to other providers throughout, just throughout the whole New Orleans area and the West Bank area. So anybody could join in because it's set up that way. And the 401k plan is set up the same way that the school system, the teachers' 401k plan is set up. And we did that intentionally because we feel as though secondary education is important, but we all know that early child care education is very important because it leads them into the success of, that trajectory. So, with that coalition, we're able to break down some barriers. I mean, that was not even heard of, even though Some providers were already doing it. In Jefferson Parish, the funding is very, very limited. We working with 4P by P and being a business coach for 4P by P, educating our providers and educating the constituents on that these are the things that are important, these are the things that are needed, and these are the things that you want when you go to work. And I always ask myself, if I don't want to work for myself, then I can't possibly expect someone to work for me. So it has to be attractive enough for me to want to do it in order for me to convince another person to do it.
Absolutely. I love that. I love that. So that being said too, with all, now I'm going to turn it to open it to all of you again with the benefits that you're providing. How has that affected the recruitment and retention of your employees and staff?
So I can go right there because mine is really, really quick. So I know that for me, just having a benefit package is attractive in an interview, even if they don't want to do the work. They're like, oh, wow, I get this, and this, and I also get paid. So for me, I have to say that the retention has been better, even though we're in a workforce crisis, even though I still need employees. But the simple fact is that it's always better. It's better than what it was before when I was doing interviewing and I couldn't offer it. And then at my programs on the West Bank, I have NSCCD. I have a high population of NSCCD children. I have like 84-year-olds in this population, right? And because I have, in one of my centers, I have a huge Latino population, and I have like 84-year-olds. So just with that, the certified teachers that I have to hire, my teachers have been with me for quite some time, and those teachers are retired. So offering them, even though they come with their medical benefit and other benefits, what happens is that even working for me, their 401k, they could keep increasing it because they're still, working, working all those, those part-time hours. So that's very attractive for them in an interview. So I can honestly say about retaining teachers that really want to be teachers, understand the importance of a benefit package. But employees that don't want to be teachers and come into the field, well, then those are work losing.
Yeah. And just to add, this is Kristi, just to add to what Monique is saying, we have, with the different benefits and all the different things we offer, we have a really, really good retention rate. I won't say we might have turnover maybe 1 or 2% each year. So we have retained people, and even just sharing with people our all the benefits and all the things that we offer. We see people, even the young people who I thought probably wasn't going to worry about it, they are very excited about it. And, if even in our 401k match, the 3%, we have 85% of the staff that participated. And I view it a lot. And I'm looking at it, I have one staff that got about $15,000, $17,000 in that. So it's just amazing to see that how much money they are trying to save, and also thinking about their future later, because we work with our 401k, we work with Joan, so she was able to really to come in and educate them about 401k and talking to them about Rule of 72, how that looks from them 10 years from now. And it just kind of blew people's mind. It blew their mind. It was just like lack of knowledge what people had, and to be able to get that information, it made them more they wanted to be that. And they, even when they came from other childcare centers, they talk about people are not offering us all these different things, and we appreciate this. So even if they decide they don't like some of our rules and policy in the vision, they decide that when maybe they go looking around, because I know some go look around, they never leave, because they're like, wow, y'all have the best benefit package, and we try to make sure we have the best environment. But, you know, just sometimes staff don't understand that the children come first. And this is not a job where you just could come and play. You know, this is early childhood where children, we are making sure these children are ready for school and these kids have the confidence they need. And I know it's hard work. So that's why I sacrifice a lot of things to be able to give you all these benefits and do the different things, because I've done it before. I wouldn't ask somebody to do something that I've never done. And I worked in a classroom 3 years when I first opened my center and ran the center, and then had to leave and go work a night job because I wasn't making no money in the center, you know, until I was able to grow. I had to leave the center at 5 and go work till 2 or 3 o'clock in the morning and then come back at the center because I was not making enough of money. So I had to stay at that restaurant and still do that work just to be able to afford to take care of my family, you know, because my business was not doing that. So I understand what Monique is saying about being broke, because we were broke too. But the man, he wanted me to stay there so bad, so he made arrangements for me to work 30 hours and keep the pay that I was making just to keep me there, you know. And everybody don't have the luxury of that, but I did have the luxury of that, and then had the opportunity to still grow my business, to build it to where it is today. But it's really hard for us, because even though we offering those things, and everybody who's sitting on this phone know every day cuts are coming, this is coming, we not sure we're going to have this, or we're not sure we're going to have that, and we can have these great benefits, and then it could be just taken away from our staff because of we don't have consistency of people understanding the importance of early childhood and what we should be getting paid. And I just thank God for our CDC's program and the state match and Agenda for Children, building a relationship with them to understand that they need to pay us as a higher rate. And like when I talk to childcare centers, I say, you got to ask for what you'll work, because I'm with an early Head Start program. And I told them, hey, I started with 48 seats. Now I'm down to 32 seats. And I'm like, if you want me to continue, you got to find the money to pay me more money if you want me to be a part of this program. If you say you like what we like. And they're restructuring their whole early Head Start program to meet those needs, because they still want me and the other partners to participate. So, you know, we have to continue that fight to get the funding, because without the funding, it's hard. And people say, well, how you do it? And some people can't do it because everybody's situation is different. Some people may just have a party capacity and they can't do that. You know, I have a situation where somebody built me a center and charged me $1,000 rent every month. So I have more money coming in to be able to offer business benefits. But everybody's situation is not the same. And that's why, despite what we're trying to do, is going to be hard. But it has to first start with every child that's sitting in the seat is being paid the same amount, no matter if it's private pay, state funding, match, everything should be the same and be paid the right amount of money, but we could be able to continue to offer all these great things, higher pay, benefits, and everything for our staff.
Yes, yes. And look, you're getting a lot of love. All of you getting a lot of love and thumbs up and co-signing in the chat. So thank you again. And Jonathan, if you want to just kind of comment on how
So as far as the recruitment piece, we didn't see a whole lot at the very beginning, but what we did notice is our retention rates were drastic. And we found that a lot of these younger employees don't know. They don't know that they need to save money. They were never taught. They were never taught how to balance a checkbook. A lot of these things that they didn't know. And so we kind of felt like it was our duty to make sure that, we were there to take care of them. But eventually, like I think it was Monique that said it, that, people talk. And whenever these providers would start talking, these employees would start talking, whether they came from another center, word would start getting around. And then we even noticed around our area and even around the state, we'll be at the Child Care Association conference and we'll get phone calls. I'll get pulled aside. Hey, how are you doing this? This is great. Can we want to learn? We want to do this. We want to do that. How can we, can you help? And so we're trying to help other providers throughout the state do the same thing. And it's been fun. It's been quite interesting.
Yeah. Yeah, sounds like it. Well, we are at time for our panel, but thank you guys so much. Audience, please continue to DM me your questions. Again, you guys are getting a lot of love in the chat, so please pay attention to that as well. I am going to move us to our last speaker for this webinar and we wanted to bring on this particular speaker because we understand that providing benefits, as you guys are doing, is not feasible for some centers. And so at this time, I am happy to introduce Taffy Morris. She is the Resource Development and Analyst Specialist with the Southwest Louisiana Area Health Education Center. And she's going to talk about their Health Navigator program and how they support early childhood educators in finding and applying for benefits. So Taffy, I am happy and excited to turn it over to you.
Thank you, Candace, so much. I am so excited to be engaged in this conversation because I am so intrigued to hear all the innovation that's being done to be able to offer benefits and be able to recruit, because we are traveling across the state, working with all 1,600 of the centers across the state, and we are hearing challenges from small centers to larger centers. So I think they definitely can learn from you guys. And I'm glad to hear some great things happening in benefits, and especially with health insurance options. But let me tell you a little bit of who I am. My name is Taffy Morrison. I am the State Outreach Manager for Navigators, as well as a Resource Development Partnership for SWALEC. And Louisiana Department of Education, several months ago, it was actually kicked off in New Orleans at the conference, kicked off a partnership with us to be able to offer low-cost health insurance options for educators and directors. So if you go to the next slide. So this partnership was developed and we were contracted with our DOE to provide these services mainly to type 3 and FCC childcare educators to see what options are available. Because just like you guys have shared, they don't know what's available if they don't know what's available. I mean, they don't know what could be some options for them unless others share with them like you guys have today. So next slide. So who are we? Who is the Navigators for Health of Louisiana? We are a free federally funded nonprofit program supported by a grant from the U.S. Department of Health and Human Services Center for Medicaid and Medicare Services under the Affordable Care Act. Most of you know, President Obama about 11 years ago passed the Affordable Care Act to reform health insurance and also to offer more affordable options for those that are not eligible for Medicaid and not eligible for employer insurance. And so we have held this grant for 11 years to be able to improve that education across the state and access in all parishes with this low cost or no cost health insurance options depending on availability. Now, I know that with a survey I read that majority of educators, like you guys have mentioned a lot, are on Medicaid. But for those that aren't on Medicaid or they're not able to offer benefits, as far as health insurance, group health insurance for centers, there are other options. And so what we are doing is providing that one-on-one assistance with applying, updating account information, educating about health insurance options for Marketplace, Medicaid, and LaChep. This is what we are certified to do. We have the partnership with Medicaid to do Medicaid applications, and then we have a partnership with Center for Medicaid and Marketplace Services for the Marketplace applications. But we don't only help with making sure that applications are provided, but we make sure that they know how to utilize their health coverage and locate providers. I'm at a rural health conference right now, and I did just talk to a provider, a rural health clinic that said, that's great to have all these plans, but we aren't certified to take these plans. We can't accept those. So what we do is make sure that the coverage they have, that their doctors are on that coverage, their prescription drugs are on that coverage. We make sure they have access to preventable services. I've had directors tell me that, I know none of my educators have mammograms or colorectal screenings. They haven't had that because they don't know how to access it or they don't have the insurance to be able to access it. So we do this by providing several options for those centers. And we do this by on-site enrollment opportunities. We come to centers and help them with the application process. And we aren't 8 to 5 workers. We work very remotely. And so we work during hours, after hours. We often come with director's approval to work with educators during lunch and nap time. That seems to be the favorite 11 to 2 time. And we often come during that time. Next. So where are we now? And what have we been able to do in the last, really, we've been activated probably about 8 months, 8 to 9 months at this point. We have at this point done about 160 centers. We have worked with, engaged at about 160 centers. We've educated about 2008 educators. We've had about 108 outreach events, and we've actually done educated through about 690 directors and educators have attended presentations that we have offered at their centers or through the LDOE webinars or to presentations like this. So we have spread the word, but we know there's a lot more to do, and there's a lot more to educators that we would like to reach and assist. Okay, so when we are helping educators, what are we doing, and how are we facilitating, and who are we helping? We're helping those educators that don't have any health insurance. They don't have, like the panel before, it was great to hear what you're offering for a center, but there's a lot of centers that, you know, they do not have any health insurance options and they're not eligible for Medicaid. And so, or you're not offered, like I said, through the center, or you can't afford what is offered through a center, through the group plan, or you can't afford a spouse's plan, even they're offered it through their employer, they're offered a group plan. Possibly you can't afford that. And I could say that myself, that, you know, if I was just to have me on my plan with my company, it'd be $150 a month. But when I add my husband, it is about $900 a month. So it definitely jumps, and something that's very unaffordable for many to do that. Or say you're no longer covered under a parent's insurance plan, that's $26 for private, and it's Medicaid, it's $19. So that's when they usually have to transition. And so a lot of our young educators are in that position, that they've never had to have health insurance themselves, and they're often confused and overwhelmed. They don't know how to help, or where to get help. And there's been a lot that's lost Medicaid coverage. You could probably say in your centers, you've had at least 1 or 2 educators that's lost their Medicaid, or they've lost other health insurance. I had a director call me last week, I think it was, that her husband was laid off from his job that he'd had for 30 years. And she doesn't have child care at her center, insurance at her center. So she is now seeking insurance, and we are able to help her with that. Next. Okay, so I mentioned earlier the 2 things that we are certified to do, and all our navigators are certified, and we work remotely, and we're in all 64 parishes. We help with the marketplace health insurance and also Medicaid. So these are what we are certified to help with. We are not brokers or agents. We are a nonprofit that helps with the application process and assists to make sure everyone in our state has health insurance. Our goal is 100% of all educators, directors have health insurance, and also all their family members, all their aunties, all their church members, everybody in the whole state has health insurance. And so that is our goal and our priority. But I love sharing the story on the left that we had a educator in Gonzales she was actually in her 30s. She was, you know, very young. And so she had lost her Medicaid coverage, and she was also a cancer patient. She was really scared that she couldn't continue her cancer treatment. And so the director heard about a program at one of the LDO webinars and contacted me that day. I had somebody out to her that day, that afternoon, who was able to transition her from Medicaid to a marketplace plan, so she didn't miss any cancer treatments. All her doctors were on it, and she actually was able to get one of the 0 premium, 0 deductible plans at no cost to her, but she was right about that Medicaid limit. So we love hearing stories like this, that these are life-saving stories that with our educators that we're able to accomplish. So what has happened? Why have some of the educators across the state lost their Medicaid? They've been on it for many years, and now all of a sudden they've lost it. And as a director may have increased salary trying to offer more to them, but when she did that, or he did that, they lost their insurance, their Medicaid, okay, because they were no longer income eligible. So what has happened these last year is that during COVID, they froze all the Medicaid rolls, and money was given to Louisiana Medicaid to have more members on at that time. Because during COVID, they didn't want anybody not to be able to have health insurance and be able to get, but yeah, I see some of the fears. Thank you, Kristi. I see what you're seeing in the chat. And so what they did is everybody was eligible, no matter if your income went up or down during COVID, everybody stayed on the rolls. Well, that changed as of April of last year. Congress made it where each state could recheck the rolls again. And so, but by that time, we had over 2,055,000, the largest on our Medicaid rolls. And so they are taking a 12 to 14 month process. And so we're still, why am I still talking about this? This happened last April. This is going on through July. And then there's another transition happening now that is also affecting our educators that have Medicaid. So they went through a 12 to 14 month process, checked about 150 members a month, and sent termination letters, renewal letters. They've checked their income to see if they're still eligible. And so they started terminating members last July, and it will end in a few weeks. Thanks. So what are they checking? How do you know if you as an educator or you as a director that your educators are still going to be covered by Medicaid? Qualifications have not changed. You're still, if you're a low-income parent of a child under 19, you're a child under 19, you're pregnant. There are some cases of certain cancers that are covered, or because we're a Medicaid expansion state, we have coverage for Medicaid for 19 to 64-year-olds. That's not always the case in other states. For example, Texas, Florida, and Mississippi do not have expansion, so that is not offered to them. That's usually only marketplace. And obviously, if you are considered disabled by the Social Security Administration, you still can qualify for Medicaid. Next. This is what did change. So every March, income for Medicaid changes. It usually goes up. It didn't go up much. It was only about $300, I think, a month. So it didn't go up. But if you hear a family in your center, as well as your educator, say, oh, they kicked me off of Medicaid. You know, I don't have any insurance anymore. This is probably why, because if their income level is for one individual above $20,784 a year or $400 a week, they're no longer eligible for Medicaid. Or if it's a family of four, it would be $828 a week or $43,000. Now, this is just for adults. Okay, children are qualified at much higher rate. I'll often have families that have a husband that has employer insurance, a mom who has Marketplace, and children have Medicaid, and that's all acceptable. And that's great that we have the freedom to have those options. Next. So this is what's happening right now. So, and I know many educators have fallen into this gap. So these are the renewals they've done through April. I will have you updates in about 4 days for the May, but they've checked about almost all but about 200,000 of those that are on Medicaid. They've checked their accounts, and about half were automatically renewed because they have this software program that checks the wages. Every time wages are turned in to the state and to the IRS, they will check it. And then so about half, the other half were mailed these renewal packets, and they were mailed, and that was a huge problem, and still is a huge problem. People don't check our mail like we used to. We pay everything online. We don't check that. And so a lot of people miss these renewal notices. So about half of those were renewed, and then another were deemed ineligible because of the income or they got an employer plan. But the 371,000 Medicaid members, and a lot of these, I talk to educators every day who fell into this gap, did not receive those notices or those renewal packets, and they were terminated. You have 10 days to return that renewal packet, and if you don't return it, you will be terminated from, no matter if you're still income eligible. So there's a large amount that have been terminated at that. Total terminations have been 500,000 at this point. We do expect it to be much higher in the next couple of months. So it's about 550,000. So that's why I know your educators, and we've traveled across the state to here, are in this gap that they have lost that coverage. And a lot of your children you serve, there's been 174,000 children that have lost their Medicaid coverage. Next. Now, what has changed? Now that is ending as far as the COVID checks, okay? But now the legislation has passed that every Medicaid member account will be checked for their wages every 3 months. So every 3 months, a Medicaid member could receive a renewal notice to submit pay stubs or any life change. If there's a child that's aged out of a chip or any other life change that has happened, marital status, they're going to be asked to submit renewal information every, they're going to check it every 3 months. So this is a major change. This has usually been once a year. So this is why it's so important that we're trying to spread this word, because people aren't, well, again, this is being mailed, but we teach them a lot of other ways that they can make sure they can keep their account active. So this changed May 13th of last month. Next. So how are we helping educators make sure they don't lose their Medicaid coverage? When we present and when we educate our educators, we do enrollments with educators, we make sure they have a Medicaid self-service portal at mymedicaid.la.gov. That way, they can check the status of their account at any time. They can update their account information, request new cards. But what the big thing to us that's been really poignant is that every document that's ever been mailed to them, that renewal packet, is in that portal. Typically, every time it's not, it's missed. But a lot of times when I'm doing presentations across the state, they'll say, well, I know I'm probably no longer income eligible, but I still have it. And we will go to their portal account and see the document that says you were going to be terminated in 5 days. And we see that all the time. And so we want to make sure that all our educators know that have Medicaid know about the portal. So this is what we educate at centers across the state. Next. Okay. So say that the income is no longer eligible for Medicaid, or they're not eligible to Medicaid, or a director does not have access to group insurance, is not offered to the center. And what are the other options? The other option is the health insurance marketplace. This was passed during the Affordable Care Act. This is private health insurance that is, the premiums are federally subsidized based on income. So when I say private health insurance, I'm talking about Blue Cross, I'm talking about United Healthcare, Ambetter, HMO Louisiana. I'm talking about names that you do recognize in healthcare. And these are like plans that you would get if you were at a corporate employer. And so these are plans that they're basically, I tell them it's like sliding scale. So the lower income you have, the lower the premium and the cost is going to be. Like the Sarah, the educator that had the 0 premiums, she was right above that Medicaid limit. So the higher you make, of course, your premiums are going to increase. But this is not the supplemental policies that's been talked about a little bit earlier. This is not supplemental. This is comprehensive health insurance coverage. It's not just dental and vision or some of that. It's not disability. This is comprehensive health insurance coverage where you get tax credits for your monthly premiums, reductions and copays. You also get reductions in that. And we do see a lot of people that have $10 or less premiums, about 4 out of 5 that we work with. But again, I can't tell you what that's going to be until our navigator works with you or one of your or a staff member to be able to know what they would be eligible for or a director would be eligible for. Next. This just tells you a little bit about what's covered by these comprehensive plans. There's also offered dental that you can get as well. So it is comprehensive. Prescription drugs, pediatric service, emergency services, lab services, maternity, all of these are covered by these health insurance marketplace plans. But again, when we work with you, sometimes not all clinics accepts all the plans. And so we're going to make sure when we work with an educator that we're going to put their doctors, when we do the application, their doctors send prescriptions into the plan that they choose and make sure it's covered before they leave and before we finalize. Next. So who's eligible? If you're a U.S. citizen, you're eligible. Every person here legally, you're eligible. It is not income based to apply for a marketplace plan, but you cannot have Medicaid and marketplace. You can't have Medicare A and B. and Marketplace. And if you are offered affordable employer health insurance through a spouse or through your center, if it's deemed affordable, and we have a formula we use for that, if it's deemed affordable, then you can apply for Marketplace. You will have to take the employer plan. But we work with educators to say, okay, let's see if this is affordable based on your income. And we have to put non-incarcerated. I know that none of you are incarcerated, but that is one of the criteria that you cannot be incarcerated and get a Marketplace plan. Next. Okay, so when can you enroll, and when are educators eligible to be able to enroll? Because this is private health insurance, there is an enrollment period with Marketplace, but if you lose health coverage, if it's employer plan, or you're no longer eligible for Medicaid, like I mentioned earlier, you can apply for that at any time. If you've moved, if you get married, had a baby, are in certain low income levels, you can apply at any time for Marketplace. We work with educators to try to make sure they can meet this criteria for special enrollment as much as possible. But if there are a few that we have had to wait to open enrollment, which is November through January. So obviously Medicaid you can apply for any time, and we assist with those applications. Next. Okay, so what are we seeing and who have we been assisting as we've been these last few months working with centers? We've assisted a lot of educators that have been terminated from Medicaid and lost insurance coverage for themselves and their family, and we've transitioned them to Marketplace. We've had a lot of educators that had no health insurance coverage. They lost it through a divorce, change of job. They were a new resident. They moved into the state. They aged out of parents. We've helped them obtain comprehensive coverage either through Medicaid or Marketplace. We've helped a lot of educators update their account information so they can continue coverage. They may not have a current address. They may not have the current information about their income or anything like that. We're making sure that they can continue their coverage. And so we work with them. We also have made sure that educators understand what Medicaid coverage is and the market-based benefits that they have and the additional benefits they are eligible for. Dental, for example, we help a lot. Dental is not great with Medicaid. So we a lot of times will connect them to federally qualified health centers in the region who have dental coverage at sliding scale. And so anyone that doesn't have health insurance or they're waiting for their application to be approved, we're going to get them into a clinic that's located, that has a sliding scale, that they can still get healthcare services. We've also helped a lot of family members. So we're not limited to educators. We've helped aunties, we've helped moms, we've helped sons, daughters, church members. We've helped other people in the community that they refer to us. So we're not limited to educators. We can help any resident. Next. These are just some of the stories that we've heard from our educators and directors. You can see some of these. They may have lost their coverage and they need help to fill that gap to meet the basic needs of life, which is health insurance, to be able to get health care. There was another educator who went through a divorce and her husband had dropped her plan. She was no longer coverage. And so we were able to help her sort through the plans. And when I say sort through plans, there's usually 30 plans with Marketplace that you have options for, which is overwhelming. They're co-insurance, co-pays. There's just a lot of different options that you do. We help sort through those and make sure it's something that's affordable and has your doctors on it and has the coverage that you need. Okay, and so this particular educator was able to get Blue Cross Blue Shield plan that covered all of her needs. And this another director, she had not had health insurance for a long time. She kept checking and it wasn't affordable. She just prayed that she never was in a car accident or ever got seriously ill. And one of our navigators helped. And so she was relieved that she was able to get a plan for $50 a month as a director. So these are just some of the shows. Okay, next. Thank you, Candace. Okay, so what do we want you. We want to work with your center. We want to work with your educators to make sure they have the health insurance that they need. Next. So like I said earlier, our goal is all educators and family care providers and their families have comprehensive health insurance. And so there's multiple ways they can be provided that. The panelists shared some of those ways. but then we are also another option that can help with that as well. Next. So how do you connect with us as navigators? Like I said, we do have the LDOE partnership. And so we can connect directly with directors, with educators at centers. So just basically reaching out to me. I'm the liaison for the partnership. And we meet with the director, the owner, discuss what their needs of their staff are. We usually like to schedule a 20-minute staff presentation at the center. That can be in person or Zoom. I've done 2 or 3 Zooms in the last couple of weeks. And usually we do that during nap time, lunchtime. We do it in multiple sessions so teachers can rotate in and out. We've spoken a lot of professional development days, continuing education days. And after we do the presentation, very similar, you've got to abbreviate it, a little similar to what I've showed you today. We take requests from staff of those that are interested in needing assistance. I was just telling Candace earlier that we had Shreveport, we had a center that reached out to us, and we helped 13 staff in one day to be able to make sure. And out of that, we put 4 on Medicaid, and we had about 6 that went on Marketplace, and the others we just updated their account information. So we schedule usually after we have the request, we schedule that on-site enrollment to help those educators, like we did with 13, at the convenience of the director. So we can do that at lunchtime, nap time, whatever's convenient. We do come to your center. And then you can also at any time throughout the year submit referrals to us for our services when you hire new staff. When any staff has experienced a life change, they lost their Medicaid or any of the situations I've talked earlier, or they need help with a family member, you can refer to us at any time. It is being used as a recruitment tool, as a benefit tool that you can, although we aren't, like the center's not able to offer health insurance, we do have a partnership with LDOE that does. Next. So what's your next steps? What can you do? Reach out to me. I will also send an email follow-up that's can be sent out to everyone as well with my contact. Just reach out to me. You can fill out a form on our website at www.getcoveredla.org. You can scan our QR code. You can call our 800 number. No, that does not go to India, China, or wherever those numbers go sometimes. It goes to our Lafayette office. It is our main office. And so you can call that number and just tell us what your needs are. You can do it individual as educators or directors. If you want a presentation for your center and your educators, you can also fill out this form and you say, check, I'm a director. Okay, next. And that is basically what we're able to offer. We hope to continue this to and reach more educators and more directors. We have been a lot in the New Orleans area. We do find the North, we not have as many centers reach out to us in the North, and Northeast and Northwest of the state. But we are covering the entire state and all centers across the state. So we encourage you to reach out to us. Let us see what we can help and provide for you as educators and directors. And we're always available for questions at any time, and we're always accessible. So.
Thank you. Thank you, Taffy. I mean, a wealth of information. And don't worry, for those on the call, you will get a copy of this presentation with Taffy's information. And I think with time, we may have room for one question before we close out. So you can utilize the chat if you have a question for Taffy.
I have a question.
Yes, go ahead, Kristi.
Yes, Kristi.
Well, my question is, I had like a lot of my people are falling off of Medicaid, so we are going to schedule that meeting with you. But I had one particular lady. She went and she got health insurance and everything because she got cut off of Medicaid, and she has a serious issue that she has to have a surgery. So she found a plan that was just $360, and she was able to afford it. But when she went to set up for a doctor's appointment and, have the surgery and stuff, she had to wind up paying over $4,000 to $5,000 to even start the surgery to happen. And she could not afford the surgery, even though the tumor is growing and growing each day. So she had to come to us and request just to work like 20 hours a week and work part-time just to get Medicaid back to have her surgery. And she's still waiting, but she just did a scan, MRI, and the tumor has doubled in size. But how do we support? I mean, I know there's health insurance out there, but how can we as providers or you as to educate what other supplement things there's out there to help them when if they have to have a surgery or something major happen like cancer or anything, how do we help them so they can still get these things they need because it's still too costly for her to pay for?
So one of the things I'm going to encourage is before any of your educators go, like say on the marketplace, because anybody can go on the marketplace and apply. Okay. But a lot of times there's not somebody sitting with you explaining co-insurance and co-pays. So I am scared you have as co-insurance, which means you have to pay your whole deductible before anything kicks in. And so that is one of the reasons why we encourage you to reach out to us as navigators, because when you go on healthcare.gov to apply for marketplace, when you hit the contact information, there's about 50 brokers that are going to blow your phone up. And they're going to confuse you, and they're going to just sometimes just say, oh, this is the only plan. They don't thoroughly explain. And sometimes when you look at those plans, you don't see those things like what the issues that you see right there that just happened. But when we would sit down and say, okay, but understand if you do co-insurance, yes, your premium may be lower a month. If you do co-insurance, when you go to the hospital, you're going to have to pay your whole deductible. Or it may be better to do a copay. And so when you do a copay, you're going to pay 20% or 10% or whatever the copay is. So in that situation, you know, I'd like to look at with her and say what plan you have and can we get you a better plan? One.
Okay.
The other thing that I worked for health systems for 24 years. And so I know health systems and how they work as far as billing. And so what I would ask is to go back to that hospital and ask if there could be a reduction in the cost because it's unaffordable for her, and also put her on a payment plan.
Oh, that would be awesome. So thank you, Kristi, for bringing up that example. And we
Thank
do have Taffy's information on the screen for those who want to grab it right now. Again, this has been a wealth of information, and just really want to say thank you to all of you for joining our webinar today, and for those who have been with us throughout this compensation series. And so we certainly hope that this series and our compensation website is helpful to all of you as you work to support early care and education to our early education workforce. And so we also encourage you to have conversations about the issues we covered in these webinars with your state and local elected officials. Shout out to Representative Phelps, who was on this call as well. So again, we understand how critically important it is, just early care and education in all aspects of our economy. So please continue to have these discussions within your communities. If you would like to work on local partnerships for childcare in your area, we're happy to be a source of information for you. You can reach out to us at info@policyinstitutela.org. And then we know there was a lot of information that was shared today, so you will receive a recording of this webinar, and we'll also include the links to previous webinars in this series. Again, thank you so much to all of our speakers, our panelists, for sharing a wealth of information. Thank you so much for being here, and we hope everyone who has attended these series is leaving with some useful knowledge to help move the field of early childhood education forward in our great state of Louisiana. Thank you, everyone. Y'all have a great day.